Everybody, this is Andrew Cosman, physiotherapist with ADM Ottawa Physiotherapy. Continuing our series on some of the commonly asked questions, we came off of talking a bit about the difference between physiotherapy and massage, and that sort of begged a more basic question about what physiotherapy is to begin with. I'll read you the definition that's shared on one of the association's websites, where it says physiotherapy is treatment to restore, maintain, and make the most of patients' mobility, function, and well-being. Physiotherapy helps through physical rehabilitation, injury prevention, and health and fitness. Physiotherapists get you involved in your own recovery. So there's the basic definition. And one thing that not a lot of people know is that this can be done through a variety of domains. Maybe the most familiar one is the orthopedic domain, where people will have a neck pain or a back pain and come into a clinic setting and receive care for that. And there, the goal, like was mentioned, is treatment to restore, to improve, and to get back to where you were. Um, there is that maintenance piece where somebody may in fact be declining because of the nature of their injury, and that's where we see it in a different domain a little more often, more neurological settings, but not necessarily only that, because with the aging population there is a very real goal of wanting to maintain a person's physical function, without necessarily a huge desire to improve it or a realistic desire to improve it. Um, and then, of course, you have simply the people who would like to, like we said, improve. There's nothing necessarily wrong that we're trying to restore, but they are trying to do better at whatever their maybe sport of choice might be. So we talked a bit about the orthopedic domain, the neurological domain, and there's a third domain, the cardio-resp domain. So cardiorespiratory rehabilitation exists for people with heart and lung issues, which is not something that is commonly associated with physiotherapy, but it is something that physiotherapists get trained for. And depending on if it's a domain they work in throughout their career, they kind of develop those skills more so than maybe some of the other skills associated with different types of therapy. Um, so how does this get done? A lot of the times within the orthopedic setting, this gets done with different types of therapy. So one commonly used technique are manual therapies. This could range from joint mobilizations, joint manipulations, soft tissue work, and this sometimes gets presented in different packages and in different ways, different names. But in some cases, it usually involves some sort of joint technique or some sort of muscle technique, to keep things really simple. So manual therapy, people are familiar with physiotherapy for electrical types of therapy like interferential currents. Short form is IFC, or a TENS unit, which is often likened to a Dr. Hose type electrical stimulation. So that exists within physiotherapy, something like acupuncture, and probably the most important is exercise. And I think that's really what sets us apart from many of our colleagues that aim to help very similar type injuries, is the importance that exercise takes place, or the prominence of the exercise within the program. If you recall the definition where it says physiotherapists get you involved in your own recovery, this is really a way to empower people to take care of themselves outside of the therapy sessions and beyond their physiotherapy sessions, where the goal is really to get people independent. Um, so if you think about some of the other ones that are treatment interventions that are a little bit more passive in nature, receiving manual therapy, receiving acupuncture, or otherwise, sometimes these things are more comfortable and more enjoyable because they're not very active. But where you get the biggest bang for your buck is what you can take away with you and continue at home, and not to mention the other health benefits on the heart and lungs and so on that comes with exercise. So exercise is likely where you're going to get the biggest value. Uh, there are some countries even that adopt a model where physiotherapists function as general practitioners, GPs of musculoskeletal health, where depending on their ability to diagnose, which I highlighted in the previous session, might make the recommendations for the exercises, might suggest you see a massage therapist, might ask you to go back to your doctor, might prescribe some sort of appliance, an orthotic, a knee brace, and so on. So physiotherapists really function or have the ability to function in that capacity. Um, a final thought that I'll leave with you is regarding our musculoskeletal health in general, I mentioned this in videos in the past, where the same way we would visit a GP on a yearly basis to check in on our general health, or the same way we'd visit a dentist maybe a couple times a year, or the eye doctor every other year. It's foreseeable and very practical, realistic that we touch base with a physiotherapist on some sort of frequency in order to make sure the musculoskeletal health is going well. And that we're aging well as well as possible. Uh, it's a thought that I'll leave with you. It seems to make good logical sense on how we take care of ourselves in other parts of our body. As always, if you have any questions or comments, you're welcome to reach out to 613-820-8765. Until next time, take care.